morning. I'm Scott Harrell with the UMHS Alumni Association, and today we are speaking with UMHS 2017 graduate, Dr. Jordan Stav. And I want to welcome you today, Dr. Stav. And can you please just tell me a little bit about yourself and where you're currently working?
Thanks, Scott. Glad to be here. So I'm currently working at Ascension Macomb Oakland Hospital. It's split between two campuses in Madison Heights and Warren, Michigan, Southeast Michigan. I'm an attending physician there, and that's also where I did my residency. So I've been there since graduation.
Great. And what is a typical workday like for you, Dr. Stav, just your day-to-day life?
Yeah, so I'm in emergency medicine, so don't really know what we're going to get. My days start at various times based on where I'm at in the schedule, sometimes mornings, afternoons, or nights. And show up, walk in, log into your computer, and either you're immediately called back to the resuscitation bay to start going to work, or sometimes you have time to talk to your colleagues and see how the department's running. But usually from start to finish, it is nonstop.
Right. And I know that for a fact because we've spoken before, and you were the very first UMHS graduate that I personally spoke to at the very beginning of the COVID pandemic. That was in March 2020 when everything closed here in New York as it did elsewhere in the country. And you were one of the very first people, the very first person that I spoke to. And that was a really scary time for medicine and just the public in general. Can you just talk to us a little bit about what those days were like for you as a young doctor and what you were experiencing?
Yeah, I think scary is an appropriate way to describe it. We didn't know anything about what was going on except for people were coming in very sick, and we had to do something about it. There were a lot of changes from the top down in terms of the infrastructure of the department, how things were run, how people were categorized and triaged, where people were placed, and how we were dealing with medicine in a way that we never have previously. It was a way that defined the country medically. It defined the way we taught residents and the way we practiced. And I think we learned a lot in that time, not just about COVID and respiratory illness, but we learned a lot about the character of the US healthcare system and things that work and don't work. And I think we're able to advance from it, and we've come from it a lot stronger in the way that we can handle adversity coming from all different directions.
And what do you think? What do you think, just off the top of your head? What is one major thing you think you learned from the COVID pandemic as a doctor that you can share with people?
So we learned a lot about how to critically analyze the literature coming out and the research being done, and how to properly formulate our opinions. There was a lot coming out right from the get-go from various sources about certain medications that people wanted to use, uh, Plaquenil, for instance, and there's many others that came out since then. And when we as a whole peer reviewed and actually reviewed the literature, we determined what was beneficial, what wasn't. And it helped immensely with how we move forward and how we review certain literature. Additionally, I think we were able to very successfully mass immunize, which helped formulate a herd immunity and help get us through a very difficult time. And I think we learned a lot about how the doctors can be trained and formulated to critically analyze tough situations. I learned a lot about myself and how I can handle extremely sick patients coming in and how quickly they would go down and what needed to be done. And I think it really advanced me as a practitioner and as a physician to be able to assess crashing patients and do what had to be done. It made me age, so to speak.
I can imagine. Yeah.
So yeah.
Okay, so on a much lighter topic, could you just tell me a little bit about why you chose UMHS over other med schools?
Absolutely. So UMHS really stuck out to me for multiple reasons. The class sizes, the campus, uh, the live cadaver lab, or I shouldn't say live, but the in-person cadaver lab. The semester that we had in Maine, that really helped us prep for clinical rotations where we were able to do clinical rotations. I was able to do a lot back in the Detroit area, which was greatly beneficial to me. And I had some friends that were at UMHS before me that had great reviews and highly recommended it, and really haven't looked back since. I've been able to do everything I've wanted to do and became a successful physician because of it.
Okay, great. And what about your medical education, would you say at UMH? What, or at least one or two things that helped you become the doctor that you are today?
Sure. So I really do think the class sizes were helpful in formulating those small groups and being able to create certain relationships that help me focus and learn things in a different way. Um, I really can't espouse enough. The cadaver lab was the intro to me as to what medicine actually is and how to properly learn in person. And a lot of places, unfortunately, don't really have that anymore.
Right.
A lot of virtual going on. And that main semester really put me in a good spot where we were learning different systems, but having prep for the way that boards were actually done, and OSCEs, and that helped me train with patients before I even got out into the real world to do so. So by the time I was doing clinicals, I was already presenting and introducing and taking histories and physicals the way they were supposed to, because that was really geared towards us in Maine.
Okay, great. And is there anything else that you'd like to add that we have not covered? Something that about emergency medicine, or anything that you think you'd like to say to current or prospective students or even alumni out there?
Emergency medicine is a great field. There was a lot of talk not too long ago about a drop off in it, and that's not what I'm seeing at all. Volumes are higher than ever. I love what I do. It's fast paced, walk in, walk out, and it's nothing but fun and a good time for me. So I recommend anyone who's interested, please reach out. I'd love to talk to you about it. It's an unbelievable field. As far as UMHS, as I said previously, it was everything I needed and got me to where I needed to be. And I wouldn't be the physician I am today without the school I went to. So very appreciative.